How are we supposed to get things done when you feel embarrassed to smile? Trying to get a job even. When you're in an interview and you can't smile. It's degrading. It really is. I just don't understand.
There are a lot of barriers to seeking care. I mean, a dentist is one is a very intimate relationship, hard to find. People are not accepting appointments, not accepting certain types of insurance, transportation issues, a lot of those things hit that. And probably a little bit of information too. I think some people have a general fear of the dentist at times.
Because it's not just here in Connecticut, it's not just here in Middletown, not in Hartford, not in any, it's everywhere. Everywhere in this country needs help. The dental, it's ridiculous how we can't seem to help our own people have good teeth so that they can live better lives. Because what happens with your mouth happens to your whole body.
Oral health care is a crisis among the people we serve. If you see a lot of our people, they're missing a lot of their teeth. We've had to change our meal programs so people can eat softer foods. We did a survey and people can't bite into an apple because they have pain or they're missing teeth.
As Ministerial Health Fellowship, is we extend wellness kits to families. We're making them informed of, what's happening in their community, how we can help. We pretty much bridge the gap for resources.
Ministerial Health Fellowship is an advocacy coalition that really advocates to address health disparities and also the health concerns of people. Many of our people have different illnesses and everything because of the fact that they were not able to afford oral health or not able to go to the dentist because they didn't have dental insurance or just couldn't really afford it.
Organizations like the Ministerial Health Fellowship are so crucial to our community because they are the trusted messengers for those populations here that need the most help. Community leaders and the people that populations look up to for looking for things like health information.
I think the government or any funders who are even thinking about funding an organization like the Ministerial Alliance should trust in the fact that they are in the community. They understand, they know who their constituents are, they know the barriers, they know the pros and the cons, and can speak to the community and come to the community where we are.
Community advocates, providers, everybody had very good ideas. So we all got together in a room to make sure that we addressed everybody's needs, wants, and desires that could be to build a great program and to striving to always change and make it better for people. We're in the process of, coming forth with new models. I think one thing that's very important is medical dental integration and really getting the primary care person involved in the person's oral health care because it does have such a big impact in the body.
COHI exists to be a voice for those who are currently unheard. Individuals who need access to quality, affordable oral health care, but can't get it. There are barriers in the way for them. And that's what COHI is all about. We exist to strengthen and safeguard access to quality care.
I've worked with COHI on the front lines, making sure that we passed the expansion of coverage to cover people 18 to 26 with dental and vision coverage. And just this year, we were able to put coverage for periodontal coverage in the state budget and got that passed into law with bipartisan support. That was a big win.
All of the research we do focus groups, the community engagement, oral health literacy that we're providing to thousands of residents all in the state of Connecticut is because of the support of the CareQuest Institute of Oral Health. Their support allows an organization like the Connecticut Oral Health Initiative to exist.
What has been so integral and a blessing, really, for the CareQuest partnership is our ability to do the oral work health, to engage people in the oral work health. We have learned so much about the lack of oral health. We have learned so much about persons that are really not able to go to the dentist, people that have gotten their teeth taken out prematurely because they couldn't go to a specialist. But also, the most important part of it is that we get to advocate.
From our perspective, it's our intention to invest in communities that have been historically marginalized, that haven't had a traditional seat at the table, so that their opinions, their beliefs, their experience actually drives the conversations at the policy and advocacy level, drives what are the sort of practice solutions that are in place, and drives ultimately how are we improving oral health and how do we measure and track it over time.
So many times the community isn't asked what they need and what they want. And when their voice is taken into decision making, the results are much more effective.
And together, we made it work. It's teamwork makes the dream work. And we really have a good team in place between community partners, the state, and the Connecticut Dental Health Partnership members.
The only one that can save us is us. And that this is really a family affair. This is about all of us. This is our community that we love and that we care so much. And a part of that is caring for each other